Mr. Chairman.
Mr. Chairman.
And my good friend, Mr. Secretary Becerra. Welcome back to the committee. Like Chairman Neal, there's good news coming out of Connecticut and in my district. I'll bet everybody on the committee has an anecdotal story, but when someone gets up in a town hall setting and says, I was paying $1,300 a month for my health care premiums. Now I'm paying $20 a month for those premiums. He said, and with the savings that I have, I now can look optimistically to the future about putting aside the money I'm going to need to educate my two daughters. These are the kind of everyday anecdotal stories that we hear that have come from enhancing the Affordable Care Act, work that you've been actively involved in, both when you were in Congress and now in your position as Secretary. My question, very direct and simple, in dealing with the increase of inflation, and that especially hits hardest are people on fixed incomes. What is, in your estimation, the impact of extending enhanced affordable care tax care credits on everyday household budgets?
Congressman, it's the stories you just mentioned. In fact, I was in Connecticut when I heard some of these stories from some families as well. There was a mother who mentioned how she actually had more resources now to do more activity with her young children as a result of the tax credits that were being extended. Very simple things, but very important to her children to be able to do a little bit more with them. It is that kind of real impact that's made a difference for those millions. There are, of those 14.5 million Americans who are on health insurance coverage through the Affordable Care Act, there is no doubt that millions of them are there because of the extended credits that they got that didn't kick them off or have them fall over the cliff and lose that coverage.
Thank you, Mr. Secretary. My colleagues would be remiss if I didn't mention Social Security when I had a mic in front of me. So I wanted to make sure that, as I know you're aware of, et cetera, that this pandemic and people on fixed incomes has hit the elderly especially hard. And the people that are impacted the most during this pandemic have been the elderly, because they're most susceptible to inflation because they are predominantly the ones on fixed incomes. And inasmuch as Congress, not the executive branch, not the legislative branch, is responsible for enhancing Social Security, I'm proud to say the work of our subcommittee and the work of the chairman of this committee is moving forward to help lift people out of poverty. More than 3 million of our fellow Americans, mostly women, get below poverty level checks from the government, a government that found time to give the wealthiest amongst us major tax cuts, but hasn't looked inwardly to a mirror and said, hey, we're long overdue, more than 50 years since Congress has done anything for Social Security. And with that, I yield back, Mr. Chairman.